The thyroid gland is a highly active tissue that requires a lot of different nutrients to function at 100%. And one of those is a mineral called magnesium, and it just so happens that most thyroid patients aren't getting enough of it. Why is it important? Because your thyroid uses it to 1. Produce ATP to bring iodine into the thyroid gland so it can create thyroid hormones like T4 and T3. 2. Support the function of the immune system to protect against autoimmune conditions like Hashimoto's thyroiditis. 3. Create glutathione, which protects your own thyroid gland from oxidative stress. And 4. To regulate the metabolism of cortisol. So if you are someone who doesn't like the idea of unnecessarily increasing your risk of Hashimoto's, or exposing yourself to symptoms like weight gain, fatigue, hair loss, depression, and brain fog, then paying attention to your magnesium status should be a top priority. But in order to make it a priority, you have to understand what causes you to become deficient. And for hypothyroid patients, it's these 3 things. First is thyroid-related metabolism and excretion. This has to do with the direct impact that your thyroid has on how your body handles magnesium. And while not completely understood, what we know is that your thyroid influences how your body excretes, absorbs, and metabolizes magnesium. The research is all over the place, but it consistently points to these 3 things. Hypothyroidism increases the excretion of magnesium in the stool, it decreases the absorption of magnesium in the gut, and it changes how your cells utilize magnesium. The net result is a higher rate of magnesium deficiency in all thyroid conditions, including hypothyroidism, hyperthyroidism, and Hashimoto's thyroiditis. The second cause of deficiency has to do with the impact that stress has on magnesium. This is not unique to thyroid patients necessarily, but it does hit them harder than the average population. When your body is under stress, your body will move magnesium from the inside of your cells to the outside of your cells. And this movement of magnesium away from the place that you want it to be to the place that you don't want it to be results in an increase in elimination and excretion. And as your body eliminates this magnesium, it becomes more prone to stress by increasing the release of catecholamines like epinephrine. In other words, the more stressed you become and the more deficient in magnesium you become, the less resilient you will be to stress. This vicious cycle will continue until 2 things happen. Number 1, you replace that lost magnesium, and number 2, you eliminate the source of stress. And if you are somebody who can't eliminate the source of stress, which is actually fairly common, then you better be replacing that lost magnesium to help your body become more resilient. This cycle is concerning enough on its own, but it gets even worse if you have the hypothyroid state. Because thyroid dysfunction impacts cortisol metabolism, it creates an environment where hypothyroid patients are more prone to stress than the average person. This leads to faster magnesium depletion and a higher demand. Reason number 3 for deficiency has to do with diet. And like the last, this isn't necessarily specific to hypothyroid patients, but it's still important. The reality is that most people aren't eating enough healthy foods to meet their daily demands for magnesium. According to research, the average person eats way too much processed foods and not enough fruits and vegetables. And it just so happens that fruits and veggies tend to be the primary sources of magnesium. But let's assume for a minute that you are already eating real whole foods. Would you be able to get enough magnesium from your diet alone? Probably not, because unfortunately, the foods that are the highest in magnesium are often the foods that people don't eat enough of. To drive this point home, let's look at this list of magnesium-rich foods. First is pumpkin seeds, which contains 156 milligrams of magnesium per serving. Then you have chia seeds, which contains 111 milligrams, almonds, which contain 80 milligrams, spinach, which contains 78 milligrams, peanuts, which contain 63 milligrams, edamame at 50 milligrams, peanut butter at 49 milligrams, potato at 43 milligrams, and yogurt at 42 milligrams. There are some other foods that do contain magnesium, but they're at such low levels that they're not really important for this discussion. Now let's put this into perspective. The average man requires about 420 milligrams of magnesium every day, and the average woman requires about 320 milligrams. This is just the bare minimum, by the way. It doesn't take into account the higher needs that a hypothyroid patient would have due to increased demand and increased excretion. But if you were to eat the list of foods that I mentioned previously, here's how many servings of each you'd have to consume each and every day. Of pumpkin seeds, men would need 2.69 servings and women would need about 2. Of chia seeds, men would need 3.7 servings and women would need 2.8. Of spinach, men would need 5.3 and women would need 4. And of peanuts, men would need 6.66 and women would need 6.53. Now let me ask you this. Are you personally eating an average of 4 to 5 servings of spinach each day? How about 2 to 3 servings of pumpkin seeds each and every day? My guess is probably not, at least not consistently. Which is why it's no surprise that studies show that about 80% of adults are not getting enough magnesium from their diet. This may sound depressing, but there's an easy solution to this problem. Magnesium supplements. Magnesium supplements are considered an ace in the sleeve for hypothyroid patients because they offer such an easy solution to their magnesium-prone state. And because magnesium is cheap, widely available, and comes in a ton of different forms, there's really no reason for hypothyroid patients to stay deficient. But not all forms of magnesium are created equal, and some of the most common and cheapest forms happen to be the least effective. For this reason, if you have hypothyroidism, these are the forms that I would recommend. First on this list is magnesium glycinate chelate. This form of magnesium is bound to the amino acid glycine, which enhances its absorption. This form is great for increasing magnesium in the entire body. Next is magnesium citrate. This form of magnesium is bound to citric acid and is the best form of magnesium to use if you suffer from constipation. And third is magnesium L-threonate. This form is great if you suffer from issues like brain fog, depression, headaches, anxiety, or migraines. While supplements are a super easy way to replace low magnesium, they do not take the place of trying to get as much magnesium as possible from your diet. A good way to approach your diet and magnesium is to look for foods that are palatable to you and foods that you will eat on a consistent basis. If they happen to be high in magnesium, great, but if not, don't worry about that too much and just make up the difference with supplements. And don't force yourself to eat foods you don't like just for the sake of getting more magnesium. My personal recommendation for hypothyroid patients would be to try to find a multivitamin that contains magnesium as well as many other thyroid supporting nutrients like zinc, selenium, and iodine. As long as you're getting about 100 to 200 milligrams of magnesium from that multivitamin, you should be able to get the rest of your magnesium needs from your diet. And if you feel like you need more, then you can always add a dedicated magnesium supplement on top of that. In most cases, the worst thing that happens if you take too much magnesium is you just end up with a little bit of runny stool. By the way, I only mentioned 3 forms of magnesium that thyroid patients could take, but there are many others and each one provides a slightly different benefit. And if you want to learn more about these different forms of magnesium and when they should be used, I'd recommend checking out this video next.